Okay, hello. So today's videos are about health insurance networks, and this particular video is going to deal with provider contracting. So let's go ahead and get right into it. Um, One of the ways that a health insurance company tries to manage costs for its members and for itself is by entering into contracts with the medical providers in a given area. So this circle represents all of the medical providers in an area, and I'll call that all medical providers. So that's doctors, hospitals, clinics, even pharmacies, that kind of thing. It's this circle just represents everybody, and it could be a state, it could be a county, a region, whatever. But it's all the medical providers in an area. So an insurance company comes in and it begins entering into contracts with some of those providers in the area. And those providers who enter into the contract are considered the network providers. And then therefore everybody who does not enter into a contract is considered an out-of-network provider. And we'll deal with the health plan implications of networks in the next video. But what does this mean for provider contracting? What it means is this. A medical provider, doctor, again, hospital, whatever, they provide services, and the American Medical Association has built sort of a categorization system for that, and they call those they call the categorization CPT codes or DRG codes. For the sake of knowing, it stands for Current Procedural Terminology, that's CPT, and then Diagnostic Research Group. And all these codes do is they refer to every possible service that is approved by the American Medical Association. And they use that so administratively so they can set up things like billing systems, and they also use it for things like tracking quality measures. It's used; they're used quite heavily in research. So people who want to track the number of procedures that are maybe performed in an area, they want to track outcomes, that kind of thing. These are the codes that they use. And so 33405 is, I believe, it's a heart valve replacement, and that's not necessarily important, but I'm using this for illustration in this example so that we can kind of show you how they work. But if I'm incorrect, forgive me, but we're going to pretend that this is a heart surgery of some kind, and I would think that that's probably what this is. So a provider who performs this procedure, they are going to have a retail price that they charge for that. And all we mean by that is they've picked some amount of money that they decided that, regardless of whether there's an insurance contract, or at least where there is not an insurance contract, this is how much we would charge a person for us performing that service for them. And so I'm making up a number here. I don't know what this actually costs, but we'll say that it costs $45,000. The medical provider just said, this is what I charge. So the insurance company comes in and says, okay, for those providers that we enter into a contract with, so that would be everybody over here, we are going to negotiate a different price. They're going to say, we don't want to pay that full retail price. We think we can negotiate a lower price. And so they come in and they say, we're going to pay you something different. We're going to pay you, and I'm making up numbers here, $32,000. And so obviously, as you can see, it's a way that the insurance company comes in and manages its costs. So why would a provider do this? Well, one of the arguments is that the insurance company would help them get volume. So by accepting the network contract, the insurance company will then direct members to that provider, so that provider can perform those medical services, and they would be able to perform more of them. It also gives them a little bit more guarantee of payment because these are obviously big numbers, and if I'm wrong on the association between the price to the procedure, I'm not wrong in that there are a number of procedures that cost this much money and quite a bit more. And so the insurance gives the provider some assurance that the member would be able to actually pay these kinds of charges. And so that would be a reason why a provider may want to do that. But this is an area that's very political in health insurance, and there are often providers who resist that, and so they will not enter into contracts, and they're considered the out-of-network provider. But just to keep the accounting going here, you've obviously got a balance between what the retail price might have been and what the insurance company negotiates. And so we'll explain what that means. But so you say, okay, there's $13,000 here in a balance between the retail price and the negotiated price. So what's the significance of this? Well, it's as simple as this. For in-network providers, they have to accept the negotiated price as full payment. So when the insurance company says that we negotiated $32,000, that doesn't necessarily mean this is how much the insurance company will pay in total dollars. It means this is how much we will construct our plan benefit around. So when the member gets their benefits, and we'll cover that in the next video, that benefit is going to be paid on the $32,000. So this is where deductibles will apply. But the key thing is that $32,000 is a protection for the insurance company and for the member. It means that this provider, the network provider, may not charge this balance. They have to just write it off. So they must accept, and I spelled that, made an incorrect sentence there. They must accept negotiated pricing as full payment. And so to kind of articulate it even further, they may not charge the balance. That's sometimes called balance billing. So they just have to write that $13,000 off. The out-of-network providers do not have to accept the $32,000 as full payment. They may charge full retail price. In other words, they can charge that balance. Now, if your plan has a out-of-network provision, some plans don't. So it's possible to have an insurance plan that says we only cover network providers. There are a lot of health insurance plans that say we will cover out-of-network providers, but if we do, we will still only offer to the member our pricing on this $32,000, but we can't hold the provider to that contract because they haven't entered into a contract with us. So as the health insurance company, to the member, we'll only pay our benefits on this $32,000, and then that medical provider can go to the member and charge this $13,000 difference. So those are that's the high-level overview of how provider contracting works, and in the next video, we'll talk about the health plan.